Well, thank you, first of all, Senator Murray, for organizing and hosting today's hearing, and thank you to all of our witnesses. It is because of women like all of you here across the country that are speaking up, even when the circumstances are very challenging, that we're seeing attention and hopefully we will see action. You know, I'm old enough to remember when Roe was passed because I was out of college at the time, and I remember what it was like before the passage of Roe with my friends, and now we're back to that situation again. It used to be something that we celebrated. And to pick up on what Senator Warren talked about with respect to states, what we're seeing is that these extreme abortion bans are being pushed even in states like the state of New Hampshire, my home state, which has prided itself on being libertarian, on staying out of people's bedrooms and personal business. And what we're seeing now is that under Republican leadership, our current Republican governor instituted the first abortion ban in modern history in New Hampshire. And now there is legislation that would introduce a 15-day abortion ban. Now, as all of you have spoken to so eloquently, the impact of something like a 15-day abortion ban is just so detrimental. I wonder, and you may have talked to this a little bit earlier, but Dr. Floyd or Dr. Denard, could you all speak to what the implications are for women of a 15-day ban, 15-day, not 15-week, 15-day ban on abortion?
There's so much to say about that.
I know, you can't.
Many women don't know when the last date of their menstrual period was. So I almost have no words to say.
I'm not even sure what a 15-day ban is. I honestly don't. 15 days from what? And you know, as was mentioned, I mean, there's absolutely the vast majority of folks do not know that they're pregnant at that point. Right. And so that you might as well say it's a total ban. Like that's just a cover for this is a total ban because that's absurd, really.
I know I think it's probably legislation that was developed by some old guy in the legislature who has no idea what women go through and what pregnancy and giving birth is all about. Now, one of the things that I find most disturbing right now about what's happening in states is what that's doing to the ability for women to get care, because what we're beginning to see is practitioners who are leaving those states that have these really very assault, really, on women's health. So can one of you speak to what we're seeing with respect to practitioners leaving and what that's going to do to care for women? Mm-hmm. Dr. Floyd, maybe you want to start.
Sure. You know, it's very, very, very concerning. I had mentioned a little bit earlier in my remarks that we are now, we already know that there are significant major provider shortages in some areas. And the unfortunate thing is that the same places that have these severe restrictions and these bans are the same ones that have the worst maternal outcomes. That provide the least amount of resources and support when it comes to public health insurance, when it comes to social programs that help support families. So it's all linked, right? And so when you start to see providers leaving areas and you see worsening of provider deserts, then you are hands down going to see worse health outcomes. That's what it's going to mean. And I can tell you, whether it's a provider that's already in practice or someone who is training to become a provider and looking where they're going to go, we are seeing time and time again that trainees, that learners, that residents are saying, I'm not going to go and practice in a state where I can't practice medicine the way that I want to practice it, the way that I'm training to practice it. And so again, you have them going to, avoiding those places where these bans and restrictions are, which is further worsening the provider shortage. So it's very, very scary where we are going to be ultimately when it comes to the state of provider access in these places.
I've been tracking what I'm calling the OBGYN exodus across anti-choice states. And it's remarkable and terrifying because you can see a very clear line from OBGYNs, maternal fetal medicine specialists, leaving a state. Hospitals, in turn, need to shutter their maternity wards, which in turn creates a maternal health desert, which in turn creates deaths, right? There's a very clear through line from abortion bans to people's deaths because of the way that doctors need to, understandably, leave if they don't feel safe practicing medicine. And it's happening so much quicker, I think, than anyone anticipated. In Idaho, there was a study that showed that half of the OBGYNs are either leaving or considering leaving. There are only, I think at last count, 5 maternal fetal medicine specialists left in the entire state. This is already happening. This is not something that we are in danger of in the future. The crisis is already there.
And can you talk about who gets hurt the most by that kind of exodus?
It's the most marginalized among us, right? It's people in rural communities. The New Yorker had a really incredible piece about a woman who died in Texas. She lived in a maternal health care desert. The only place she could go to was a religiously affiliated hospital that didn't even mention abortion to her, even as her pregnancy got more and more dangerous, even as it became life-threatening. And so we know who is going to die as a result of these bans, and we know who is going to be disproportionately impacted. And I think Republicans hope, because it is the most marginalized among us and because it's poor women and Black women, that voters won't care. And I hope that that's not the case.
Well, certainly to pick up again on what Senator Warren said, I don't know what happened to their idea of, the Republicans' idea of, well, we should give these decisions to the states. They're seeing that when the states are making these determinations by referendum, by votes, that the voters do care because they understand what the impact is on women. And so that's why they're trying to do a national abortion ban, because they don't want to leave it up to the states, because they know that when given the opportunity, women and men who understand what the impact is are going to oppose it. So again, thank you all very much for your fight. Thank you, Senator Murray, and to all of the people in the audience. Thank you for showing up today and for continuing to advocate.
Thank you.